This is Module 4, Part 2. In this section, I'll continue the discussion on the diagnosis of mental illness and identify other common psychiatric disorders in addition to the schizophrenia previously discussed. Medications can make a difference. On the next slide, you'll see Miss Lum as she talks about her lifelong struggle with mental illness and her belief that you can overcome it. Once she was on meds, she shares that for the first time ever, she was able to find inner peace.
Started having symptoms early in my life. I guess for me, I remember feeling afraid of people and depressed too as a young child. I remember in first grade I had this idea that came to me that if people really understood what I was like inside, that they would hate me. And so the rest of my childhood was pretty much spent hiding inside, not letting people know what was inside me. So I never talked about myself with any in my feelings. I had playmates, but they would tell me and share with me, and I wouldn't share back. And another thing that happened as a child was that I had some problems being teased in school and things, and I would stuff my anger instead of allowing myself to feel anger. I would stuff it inside me and tell me it was my fault, that if I had been more like them, they wouldn't pick on me. And so it was really my fault for being different, for being somebody who was pickable. So this went on throughout high school and into my first year of college. And I remember a specific time during, I was out jogging with a friend, and it was over winter break from my freshman year. And it's like inside my mind, it switched, my mode of thinking switched from understanding people in the world and accepting them, accepting how they felt about me, if it was good or bad or whatever. It was like something was coming up, my anger was coming back up, and I could no longer keep it down. I couldn't control it, I couldn't squelch it. And so what came out at that time in my mind, I think I crossed over from mental health to mental illness. And I didn't start to hear voices until maybe a month or two later. But inside my mind, it was like I figured, oh, now they're going to find out. Now they're going to hate me. Now they're going to find out what I'm really like inside, and they're going to hate me. And so shortly after that, I did begin to hear voices. But, yeah.
Well, what was the voices like? What did they say?
For me, it was hate voices, and it has been, because the voices have continued on ever since then. But for me, my voices aren't from a disembodied source. I think I've heard a disembodied voice inside my head only once, I remember, in my life. But most of the time, my voices, they seem to come from other people in the environment. Somebody walking by, driving by, somebody I meet, mostly strangers, people. But for me, it mimics reality. And at the same time, I know that I have schizoaffective disorder because there have been times when I know I've hallucinated something. I used to hear my father say, I'm sick of it, I'm just sick of it. And I know that he didn't say that. And I heard my neighbor, a friend, say something to somebody about me. And I know later on that she never said that, and I believed her. And so I realized, wait, I am hallucinating. But for the longest time, I thought it was real. I thought I deserved it. This is reality. This is what's coming back to me for what I'm like inside, and I deserve it. And that feeling of deserving it actually it was hard to diagnose. Because even though I was hearing all these voices and was floridly psychotic, and nobody really knew what was wrong with me. So my parents, like, they used to take me to a counselor, and the counselor would try to talk to me, and no matter how much they talked, they couldn't turn myself around. But finally, my counselor told my parents, well, she can't be helped. So they took me to a psychiatrist. And within 5 minutes, the psychiatrist says, you have schizophrenia, you have depression, you need the medication, I'm going to give you this. This is an illness, you can get over it. It's not something you're doomed to feel the rest of your life. And the idea that it was an illness, that was new to me. Very, very, and to my family. To know that there was a name called schizophrenia that explained what I was going through. So once I was on medication, and the medication was strong enough, I also noticed a very profound change in my thoughts. It's like before, my thoughts had been like a whirlpool, just obsessing, thinking, how can I get out of this? How can I change myself so people won't hate me? What can I do to deal with all this hatred? It was like a whirlpool. And I remember for the first time lying in bed and feeling like I had just been thrown up onto the shore. I had been shipwrecked in the sea and the waves had been crashing over me, and I had been struggling to keep afloat. And then I found myself on the beach and just resting and feeling peace, just for the first time that I ever remembered.
Medication non-adherence. What makes it so hard for people to take their medication as prescribed?
Recently, I had to take malaria pills and yellow fever pills and things like that. And the hardest thing about that was just the time. You know, like, okay, take it at this time, take it at this time. And I usually forget, but luckily I didn't get malaria. And I just, you know, I guess it's not a big thing about eating or anything. Maybe drinking if you have to take it at a certain time. Who wants to take a pill after 8 o'clock? You might go out or something, who knows? So that could be the biggest thing. I'm not really worried about the side effects because I usually don't take anything too crazy.
I don't like taking pills, and I'm one of those people that if I feel better, I think I'm done. I don't want to take 8 more days of it because I feel good now. And so sometimes the follow through is the problem.
I always read the instructions. And sometimes I don't even take the medicines. If it's like a toothache or you have a tooth pulled and they give you strong medication for pain or something, always read that. And if I feel uncomfortable, I'll just take Advil. But read that prescription on that drug before you start taking it, because it can have all kinds of ramifications. The cure may be worse than the disease in that case.
When you get prescriptions, they all kind of come in that same orange bottle. And I know for older people who don't have good eyesight, it's going to be an issue to read the bottles and things like that. And I mean, my grandma has the Monday, Tuesday, Wednesday, Thursday, Friday pill bottles, but I've never really had any troubles with, I just haven't had that many prescription medications, to be honest, you know, try and avoid them.
I'm not on any medications per se, like on a regular basis, but like say vancomycin or some kind of antibiotic for a scratch or a cut or my eye cut, then I have to take it for 10 days and I would forget that I was even taking medication.
So as we heard, some of the factors that affect why people don't take their medication or do not adhere to the medication schedule include having to take medication over an indefinite period of time. Maybe it's a complex medication schedule or a lack of information about the medications that they're taking, so they have a mistrust or lack of confidence in the professional. Maybe interruptions in medication because of their routine, or they forget, or there's an onset and persistence of side effects. Maybe there's difficulty with mental processes that help with organization, or financial hardships in purchasing the medication. Taking medication as prescribed consistently is important to help regulate symptoms, to shorten or prevent relapse of an illness, and to help a person continue to do well over time. If a person does not take their medication consistently the way it is meant to be taken, it can have disastrous results, including symptom relapse, rehospitalization, loss of living arrangements, difficulty re-stabilizing on medication, trauma from rehospitalization, alienation from staff, and a loss of community support. On the other hand, medications are not a cure for a mental disorder, and they often come with disadvantages that are in conflict with a person's experience of recovery and quality of life, like side effects and stigma. The people that are working with that individual are a support team, and they play an important role in the individual's medication adherence by helping them to understand their medications, listening to problems a person may be having with medication, helping them to communicate these problems to their doctor, and increasing the likelihood that a person is taking the correct medication using the correct dose at the correct time and through the correct route. When someone is not adhering to their daily medication schedule, one or more of the following is usually occurring. Maybe they're taking less medication than prescribed, they may be taking more medication than prescribed, or altering the pattern of use or correct route prescribed for a medication, or they may be stopping the medication altogether. This can have serious consequences that are debilitating and humiliating for the person and frustrating for the caregivers. Putting practices in place that help folks to work with individuals will go a long way in establishing an environment where that person can discuss their medications and have the support they need to resolve problems that they may be having. Except for emergency treatment orders, all prescribed medications must be discussed with the guardian advocate before their use, including the need for blood work to monitor certain medications. Medications are often used to treat symptoms of mental disorders. These illnesses include the schizophrenia, depression, bipolar, and anxiety disorders, and attention deficit disorders. Psychotherapy and other counseling are sometimes used in addition to medications to treat a person. Medications used to treat psychiatric conditions are known as psychotropic or psychotherapeutic medications. While these medications can improve distressing symptoms, they do not cure the illness. These medications do help many people with mental disorders to live fulfilling lives in their community. Psychotropic medications do not produce the same results for everyone. As explained earlier, it's different for each person. And one person could take a medication for depression and feel much better after taking it for just a few months and then be able to stop, while another one might need to take a antidepressant for many years. Individuals diagnosed with the schizophrenia, bipolar disorder, or severe depression or anxiety may need medications for longer periods of time. When a prescription is filled by a pharmacy, the medication name on the prescription bottle will either be the brand name or the generic name. The brand name is the name of the company making the medication gives it, and the generic name is the chemical name given to it when it's developed. Generic medications are usually cheaper. It's a good idea to know the generic and the brand names for a particular medication. The medication's chemical composition is basically the same whether it is the generic or the brand name. They'll look different, so if a person gets medication that looks different than what they're used to, talk to the pharmacist. The pharmacist may make sure that it is the right medication and tell the person whether it is generic or brand form. Some examples of brand names and generic names. Medications generally have a 17 to 20-year patented lifespan. Once it becomes generically available, the medication is often referred to by either its brand name or its generic name. Prescription bottles will sometimes, but not always, have the brand name identified. Medication orders must indicate the dosage, the times per day administered, and whether the medicine is a pill, patch, or injection. Medication is the main treatment option for individuals diagnosed with schizophrenia. The antipsychotic medications are the most commonly prescribed ones in such cases. There are two types of antipsychotic medications: conventional, the typical antipsychotic, and second generation or atypical antipsychotics. It's impossible to predict how an individual will respond to a particular medication. Sometimes that person needs to try several medications before finding the right one. All antipsychotics have potentially harmful and long-term side effects that require careful supervision from a qualified physician. While medication is almost always required for successful treatment of schizophrenia, medication alone is rarely adequate to help people deal with all of their life challenges. Assistance is often required to help people cope with illness related problems, obtain needed services, become more independent, remain on their medication, and avoid future hospitalizations. Antidepressant medications are used to treat depression. Antidepressants affect certain chemicals in the brain called neurotransmitters, and these chemicals affect your mood and emotional responses. MAOIs, monoamine oxidase inhibitors, need to be carefully monitored because the foods that someone eats can affect the medication. Foods and medicines that contain high levels of the chemical triamine are dangerous for people who are taking the MAOIs. The triamine is found in some cheeses, wines, and pickles. The chemical is also in some decongestants and over the counter cold medications. People taking MAOI should ask their doctor for a complete list of foods, medicines, and other substances to avoid. Again, there's no two cases that are exactly alike. It's impossible to predict how a particular person will respond to a particular antidepressant. It can take up to 4 weeks for the medication to become effective, and people with severe or persistent depression may need to take the medication longer. Sometimes a person needs to try several medications before finding the right one. The dose may need to be changed to improve effectiveness or reduce those side effects. Even if a person feels better and believes that they no longer need treatment, no one should stop taking an antidepressant medication without first talking to their doctor. Even under a doctor's supervision, a person should gradually taper an antidepressant so that their body has time to adjust safely. While antidepressants are generally safe, they are not without risk. The FDA warns that adults taking antidepressants should be watched closely, especially during those first few weeks of treatment. Danger signs include depression that worsens, suicidal thinking or behavior, or changes in the behavior like the trouble sleeping, agitation, social withdrawal. Families and caregivers should report any concerns to the doctor. And if you're looking to give this medication to a child or adolescent, research indicates that many children and adolescents do benefit from these antidepressants. But if the FDA has issued a special warning regarding the risk for younger people taking such drugs.
While there is no cure for bipolar disorder, many people benefit from treatment. Medication works best when used as prescribed. As treatment progresses, it may be helpful to keep a daily record of an individual's mood symptoms, sleep patterns, and life events. This information can help everyone involved better treat the illness. Because all medication for bipolar disorder can have serious side effects, it is important to see the doctor on a regular basis. Note, Individuals should never stop taking their medications or change the dosage without first talking to their doctor.
Bipolar disorder or manic depressive illnesses are commonly treated with mood stabilizing drugs. These include anticonvulsant, antipsychotic, and antidepressant medications, along with lithium. Lithium was the first mood stabilizer approved by the FDA in the 70s for treating manic and depressive episodes. Mood stabilizers are usually the first medications prescribed to treat bipolar disorder symptoms. Anticonvulsant medications were originally developed to treat seizures, and then they were later found to help control mood swings. Some physicians treat bipolar disorder with these medications. Anticonvulsants work better than lithium for some other people. Anticonvulsant medications used to treat bipolar disorders are listed here and include the Depakote and the Tegretol. Antipsychotic medications are sometimes used to treat symptoms of bipolar disorder, and these drugs are often used along with other medications. The antipsychotics are ones as listed under the schizophrenic medication and include the Risperdal and Abilify. Antidepressant medications are sometimes prescribed to help treat depression associated with bipolar disorder. Examples of these include the Prozac, Paxil, Zoloft, and Leprechaun. It is potentially dangerous to take antidepressant medications alone for bipolar disorder, and doctors usually prescribe a mood stabilizer or an antipsychotic medication along with an antidepressant.
Jane's psychiatrist prescribed lithium to treat her bipolar disorder. Jane is experiencing the following medication side effects: a fast pounding heartbeat, blurred vision, and occasional hallucinations. She told her guardian advocate she feels like she is losing her mind. What should Jane's guardian advocate do in this situation? The medical team may be able to reduce the dosage or safely change the medication. Open, honest communication like this is essential throughout the treatment process.
There are many possible outcomes when a person is not taking medication as it was prescribed. Some of the adverse results that can occur include the following: unwanted symptoms return, a loss of or interruption to the gains that a person may have been making, education and social support from family and friends, hospitalization or rehospitalization, greater difficulty reestablishing or restabilizing on medication, possible homelessness, encounters with the law enforcement, accidental overmedication or overdose. Even though there are many adverse effects of not taking one's medication, there are some results that may initially seem appealing. These include initially feeling better and more normal, maybe thinking more clearly and regaining affect and spontaneity, regaining a sense of control over one's choices and decisions regarding illness and other life issues, and gaining firsthand experience of, quote, off medication versus on medication, and eliminating the financial stress of maintaining medication. Such results can reinforce a person's decision for stopping their medicines. However, these, quote, benefits usually last only a short time and are soon overshadowed by those adverse effects. It's possible to work with folks to help them understand why they need to be taking their medication. Listen to the residents' reasons for not wanting to take or not taking their medication. There was a large multinational survey that showed that psychiatric medical professionals may underestimate the frequency of the extra extrapyramidal side effects and hormonal side effects such as impotence that's often associated with the older generations of antipsychotic agents. Patient concerns about movement disorders and sexual dysfunction were common, but many felt that these problems were overlooked by their doctors. Ignoring or minimizing these communication or assuming that a person is unreliable in their perceptions will only further the chances that that individual may not remain on the medication. Their experience is real in their life, and addressing these issues can only help. Discuss medications from the perspective of the person's life. It's important to discuss the use of medications from the perspective of that individual. Taking medication must be meaningful in light of what a person wants for the quality of their life. For example, telling someone that taking medication will help them think more clearly and eliminate unwanted voices may be less important to them than understanding that the medication will allow them to participate in activities that they love, like reading, because these medications will improve the concentration needed for reading. Explore solutions that are acceptable to and workable for them. When there are problems with a medication or medication schedule, explore solutions that will not only alleviate the problem, but will make sense to that individual and will be workable within their day-to-day life. Solutions that do not satisfy the personal needs of an individual may only lead to further problems. If the person wants to take medication, find the resources necessary for them to have success in doing so. People that clearly want to take their medication because of the benefits that they experience should get all the support possible to have that opportunity. Being persistent in helping them obtain the resources that they need may be the only barrier to overcome. However, it can be a significant one. Some people stop taking their medication because they feel better, or at least they think that they don't need it anymore. But no one should stop taking an antipsychotic medication without talking with their doctor. When a doctor says it's okay to stop taking a medication, it should be gradually tapered off, never stopped suddenly. According to the literature, providing people with the information that they need to make choices and decisions that work within the context of their life will only increase the chances that they will take their medication as prescribed. The concern among some individuals that providing information will lead to a greater problem with adherence because of fear resulting from receiving the information has not been substantiated by the research. Actually, more information has generally meant higher rates of treatment adherence. Use the available support such as the following: psychoeducational groups in the local community mental health center, collaborative efforts to identify problems and to set achievable goals, behavioral modeling and reinforcement with the use of peer educators, reliable healthcare linkages, and information sharing that's available and accessible to the individual, collaboration to foster motivation for self-management. All of these help with that adherence. Be accepting of a person's views regarding their medications and always leave the door open for discussion. Working with your ward in a way that recognizes their rights to choose, providing the information and tools to make these choices, and accepting these choices without withdrawing support will go a long way in facilitating medication adherence. Some side effects, known as extrapyramidal side effects, can cause problems to the body's nervous system, like muscle spasm, muscle tremors, or shaking, or restlessness. These side effects can often be treated with special medication. The most common medications used to treat these side effects are as follows, both brand and generic names. Other side effects may not be life-threatening but are uncomfortable. For example, these include nausea, diarrhea, or difficulty with sexual performance. If a person's having very uncomfortable side effects, then they should talk to the doctor to change these medications or the dosage. Some side effects cause problems with a person's thinking, such as confusion or memory problems. Dyskinesia is another especially concerning side effect. This side effect includes symptoms such as facial tics, facial grimace, eye blinking, lip smacking, tongue thrusting, foot tapping, a shuffled gait, head nodding, and or moving one's head to the back or to the side. What is particularly worrisome about these side effects is that the person cannot control their muscle movement. Although the side effects can become permanent and lead to breathing problems, difficulty eating because of swallowing problems, mouth sores, and some trouble standing or walking.
When taking Abilify, call your doctor if you have high fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction, or if you have muscle movements that cannot be stopped, as these could become permanent. High blood sugar has been reported in some people taking Abilify. In extreme cases, this can lead to coma or death. Your doctor should monitor your blood sugar if you have or are at risk for diabetes. Elderly people with dementia should not take Abilify due to an increased risk of death or stroke. Some people feel faint or dizzy upon standing. Other risks include impaired judgment or motor skills and trouble swallowing.
Aricept is well tolerated, but not for everyone. People at risk for stomach ulcers or who take certain other medicines should tell their doctors because serious stomach problems such as bleeding may get worse. Some people may experience fainting. Some people may have nausea, vomiting, diarrhea, bruising, or not sleep well. Some people may have muscle cramps or loss of appetite or may feel tired.
Avodart is for men only. Women should not take or handle Avodart due to risk of a specific birth defect. Tell your doctor if you have liver disease. Rarely sexual side effects, swelling, or tenderness of the breasts can occur. Only your healthcare professional can determine if your symptoms are from an enlarged prostate and not prostate cancer. So have regular exams.
Any prescription NSAID, including Celebrex, may increase the chance of heart attack or stroke, which can lead to death. This chance increases if you have heart disease or risk factors for it, such as high blood pressure or when NSAIDs are taken for long periods. All prescription NSAIDs, including Celebrex, also increase the chance of serious skin reactions or stomach and intestine problems, such as bleeding and ulcers, which can occur without warning and may cause death.
Cymbalta is a prescription medication that treats emotional and painful physical symptoms of depression. Tell your doctor right away if your depression worsens or you have unusual changes in mood or behavior or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thiouridazine or with uncontrolled glaucoma should not take Cymbalta. Taking Cymbalta with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Tell your doctor about all your medicines, including those for migraine, to avoid a potentially life-threatening condition, and about your alcohol use or if you have liver disease. Dizziness or fainting may occur upon standing. Side effects may include nausea, dry mouth, and constipation.
Zoloft is not for everyone. People taking MAOIs or Pimozide shouldn't take Zoloft. Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness.
Some side effects are dangerous and can be life-threatening. Most of these side effects are rare, but it is important to know what they are and what to do if somebody is having them. Neuroleptic malignant syndrome. The body's nervous system begins to shut down. It's rare, but it can occur any time while the person is on medication. It is most often associated with the medications that are given for symptoms of psychosis. If a person's having the side effects, then they would have some or all of the following symptoms: very stiff muscles, fever, fast heartbeat, fast breathing, and or heavy sweating, confusion. Agranulocytosis occurs when the body stops making the blood cells that fight infection. This is also rare, but less rare than the neuroleptic malignant syndrome. It can also occur anytime while someone is on the medication. The medication that it occurs with most often is clozaril. The generic name is clozapine, and Tegretol, whose generic name is carbamazepine, though it can occur within any of the medications given for psychosis. If a person is having this side effect, then they would have some of these symptoms: the high fever, extreme weakness, red and painful inside their mouth, side of the neck are swollen, and or a sore throat. Lithium toxicity occurs when the body has too much lithium. Although this can happen because the dosage of lithium is too high, lithium toxicity can also occur when the person taking the lithium becomes dehydrated. A person can become dehydrated from diarrhea, too much alcohol, really bad sunburn, vomiting, or anything that causes the person to lose a lot of body fluid. If the person is lithium toxic, then they would have some of the following symptoms: mental confusion, slurred speech, vomiting, severe diarrhea, severe muscle tremors, severe drowsiness, and or poor coordination or coma. All these side effects listed are medical emergencies, and the symptoms should alert you to call 911 immediately. Older adults who have dementia and other antipsychotics such as zyperine or olanzapine have an increased chance of death during treatment. They may also have a greater chance of having a stroke or a mini stroke during treatment. The FDA has not approved these medications for behavioral problems in older adults with dementia. Medicines that can be bought without a prescription can be used for minor ailments and are usually, but not always, safe and effective, as we saw in that previous video. They can interact with other medicines and make some conditions worse. In older adults, these negative interactions between medication can occur more quickly and become an emergency. When a person uses a medicine bought without a prescription, it may to make sure that they have asked their doctor or their pharmacist if the medicine can be taken with the prescription medication that they are already taking. Over-the-counter medications that you should be especially worried about are the ones listed below: the alcohol, the antihistamine, aspirin, decongestant, potassium, salt, and sugar. Medicines that contain these ingredients can be harmful if a person is also taking medications because of mental disorder, arthritis, diabetes, glaucoma, heart condition, high blood pressure, kidney condition, and sleep problems. Encourage people to read the labels of over-the-counter medications that they purchase and or check with a pharmacist to make sure that there are no dangerous reactions that could occur. Negative interactions can occur not only between the psychiatric medications and the over-the-counter drugs, but also between the psychiatric medications and prescription drugs that are taken for medical conditions. It's very important that a person informs their psychiatrist of other medications that they're taking, whether it's over the counter or prescribed by a medical doctor for a medical condition, although it's best that they inform their medical doctor of the psychiatric medications that they're using. This will help both the psychiatrist and the medical doctor avoid putting someone on medicines that could cause harmful side effects when they are taken together. It is helpful to have the psychiatrist indicate in writing what over-the-counter medications and their dosage may be taken for common ailments.
Now let's talk about ibuprofen drug interactions and contraindications, because this is something that people are always concerned about. The first thing we want to talk about is blood pressure medications. You do not want to take ibuprofen if you're taking blood pressure medications, because it will make the blood pressure medications less effective. Gentamicin, which is an antibiotic, will also interact with ibuprofen, and it will also make the antibiotic less effective. Warfarin or any other type of oral blood thinner or anticoagulant, which a lot of times this is recommended in people who have clotting disorders, which we hear a lot about that, and it's a very serious problem. But you do not want to take ibuprofen when you're taking these types of medications, because ibuprofen also will thin the blood and it could cause excessive bleeding. Another concern with this is that if you have a cut and you're combining these medications, the area won't clot. And so this is really the major issue with that, because you don't have a way to stop the bleeding at that point. You do not want to take ibuprofen during pregnancy or while breastfeeding. And also, if you're taking lithium, which is a medication that's taken a lot of times for people who have different types of depression and that sort of thing, it will interact with ibuprofen as well. So you don't want to be taking these two together either. And if you're looking at nutritional supplements, the only two things that really have any research saying that they would interact is white willow bark, which is usually a natural anti-inflammatory. So it's common for patients to take white willow bark at the same time that they're taking a medication like this, because they think it's going to help with the pain. The problem is they will interact, so you do not want to be taking white willow bark at the same time that you're taking ibuprofen. And the other one is vitamin B3 or niacin. I don't know a lot of people that take B3. There's a lot of people that take vitamin B12 because a lot of people say that it gives them energy. But you do not want to mix ibuprofen with vitamin B3 or niacin. Now, the side effects of ibuprofen can be pretty serious, but the most common side effects are actually a rash, ringing in the ears, headaches, dizziness, drowsiness, abdominal pain, nausea, diarrhea, constipation, and heartburn. Now, the more serious effects is that ulceration of the stomach and intestine can occur, and these ulcers may bleed. And sometimes, believe it or not, you may not even feel pain with these symptoms. If you're taking ibuprofen and if you're having a bowel movement and you notice that the feces that comes out is a black color or a dark color, you need to get that checked out right away, because what that is that's blood that's clotting within the digestive tract, and that's a usual indication that you have an ulcer. We call it in the upper GI tract. So we're talking about in the stomach or the small intestine usually is where that type of bleeding can be occurring from. But that can be one of the more serious effects of ibuprofen. And by the way, one thing I should have said, which I didn't before when we were talking about dosages, one of the major rules with ibuprofen that you may not be aware of is that you never want to take ibuprofen for more than 10 days at a time if you're using it for pain. And with children, a lot of people will use this for fevers, to try to reduce fevers. If it does not reduce the fever in 3 days, you want to stop having the child take the ibuprofen at that point and see the doctor right away, because this is the reason why. If you take it for long term, you're going to start to develop a lot of these physical problems, and we don't want that to happen to you. So just make sure that you're really careful about this. There's also a reduction of blood flow to the kidneys and impaired function of the kidneys. Now, this is more of a side effect that we see a lot of times with the elderly if they're taking this on a long-term basis due to arthritis. But be aware that, just because you see something that you can get over the counter doesn't mean that it's necessarily safe or not going to cause you long-term problems. You don't want something that's going to be affecting your kidneys in a negative way, and ibuprofen is one of the things that can do that if you take it too much or too often. Allergic reactions are also known with ibuprofen. This is especially common in people who have asthma or other respiratory types of diseases. There's also an increased risk for heart disease and stroke when a person takes ibuprofen, especially over the long term.
Every individual is entitled to appropriate treatment after they are discharged from a mental health facility. Discharge planning involves making all necessary arrangements to ensure an individual's well-being when they return to the community. Discharge planning links the individual with community-based services, families and friends, and other sources of support to help avoid another hospitalization. This planning begins upon admission to the facility, and if possible, the individual should participate in the process. Discharge planning includes transportation, housing, aftercare medication, education and information, and community support. Transportation resources must be included in the discharge planning documentation, and the facility may ask the guardian advocate to help with transportation needs. However, there is no legal obligation. Mental health facility staff must request a commitment from a shelter if the individual is at risk of readmission within 3 weeks of discharge due to homelessness. In terms of aftercare, the mental health facility provides assistance in obtaining aftercare appointments for case management. These services must be requested to occur within 7 days after the expected date of the individual's discharge. Psychotherapeutic medications or prescriptions must be provided for a period of up to 21 days or until the first medication appointment, whichever comes first. Medication availability must be considered as part of the discharge planning. Written and oral information must be provided on the common side effects of the prescribed medication, including interactions with over-the-counter medications. The facility must provide information about and referral to needed support resources. These resources might include mental health treatment services, trauma or abuse recovery counseling, substance abuse treatment programs, and/or peer support groups. As a vital partner in the treatment process, the guardian advocate should be involved in discharge planning soon after the person is admitted to the facility. This involvement helps the person to receive the best possible care after leaving the facility, and it also allows the guardian advocate time to make necessary personal plans and arrangements. It's important to note that while the facility may ask the guardian advocate to help arrange housing or transportation for the person, these tasks are ultimately not the guardian advocate's responsibility. They are the facility's legal responsibility. A new working definition of recovery from mental illnesses and substance use disorders was announced by the Substance Abuse and Mental Health Services Administration, or SAMHSA. The definition is the product of a year-long effort by SAMHSA and a wide range of partners in the behavioral health care community and other fields to develop a working definition of recovery that captures the essential common experiences of those recovering from mental illnesses and substance use disorders. The new working definition of recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Through the Recovery Support Strategic Initiative, SAMHSA also delineated 4 dimensions that support this life in recovery: health, overcoming or managing one's disease as well as living in a physically and emotionally healthy way; home, a stable and safe place to live; purpose, meaningful daily activities like a job, school, volunteering, family caretaking, or creative endeavors; and the independent income and resources to participate in society; and community, relationships and social networks that provide support, friendship, love, and hope.
Kindness is more important than anything else in this world. I think that every philosopher has probably tried to tell us that. That's what it comes down to. What else are we here for but to take care of each other, to nurture the planet. What else are we here for?
If you'd like additional information about this new recovery definition or the guiding principles of recovery, visit the SAMHSA site that's listed here. SAMHSA is a public health agency within the Department of Health and Human Services. Its mission is to reduce the impact of substance abuse and mental illness on America's communities. NAMI is the National Alliance on Mental Illness, and it is dedicated to improving the lives of individuals and families affected with mental illness. You can learn more about NAMI by visiting its website, and I've got that listed here as well. You are now ready to complete the knowledge review. Go back to the M4 tab and click open the Module 4 Knowledge Review. After you completed the knowledge review, you may decide that you need additional study of this information, and if so, return to the beginning of the module. If you correctly answer 16 out of 20 questions on the knowledge review, then you may proceed to the course exam. Take the required survey and then move ahead to the pre-certificate section to complete the process for printing your certificate for this course.